Hello and welcome to CoronaNomics, brought to you by Econ Films. This week, calculating an exit strategy. As pressure mounts on governments around the world to start easing the lockdown, how did policymakers decide what to do? It's a matter of life and death, but also of jobs, incomes, mental health, education, and more as well. So is there a way we can consider all these factors at the same time? Do we have the statistics to do it? And are the measures we're currently using all that helpful? I'm Ben Chu, economics editor of The Independent.
And I'm Lizzy Burden, economics reporter at The Telegraph. We'll be your guides, and if you like what we're doing, please hit like, share and subscribe. This week, we're delighted to welcome Lord Gus O'Donnell, who served as Cabinet Secretary, the top job in the British civil service under 3 Prime Ministers. We also have Diane Coyle, Bennett Professor of Public Policy at the University of Cambridge and a former advisor to the UK Treasury. Her project, Measuring Wellbeing, attempts to go beyond GDP as an indicator of a nation's success.
Lord O'Donnell last week released a paper recommending a new approach to how the government eases the lockdown based on well-being. Judging how to ease the lockdown is sometimes portrayed as a matter of balancing saving lives on one hand and the economy on the other. But how do you weigh up elements that feel completely different? And what about the other impacts of the lockdown on mental health or our children's education, to name but 2? This week, Gus O'Donnell and a group of leading academics argued the solution might be found in a framework that measures costs and benefits in terms of a common currency, something called a well-be or well-being year, to use the full name. A whole host of different things can be plugged into this framework, from lives and jobs saved to air quality and reduced commuting stress under lockdown. When the cost of the lockdown exceeds the benefits, with both measured in well-be's, they argue it may be time to end it. First of all, Lord O'Donnell, the government has 5 tests which it's going to use to judge when to end the lockdown. They focus on things like NHS capacity, fatality rates and infection rates. But you've argued that these are too narrow. Could you just elaborate and explain why?
You did a very good job of explaining it at the start. What we've proposed is a framework to bring in all of those other effects. I think what's dominating both the presentation at every press conference and those 5 tests are the visible and the immediate. Visibly, we observe coronavirus cases and deaths, and they're immediate. So they're visible and immediate. But you think about the consequences for the economy. Most estimates suggest at least 2 million more unemployed. That's not happening today, but that will happen later. Incomes are starting to fall. What about those invisible deaths? We took at the direct consequences of coronavirus. People say about the NHS not falling over. Well, actually, for some people, it's fallen over already. They are not getting the tests. They're not getting the treatment they would like. That's going to result in a number of them dying earlier than they might otherwise have done. So you have to bring all of those things together. It's not easy. It requires value judgments. And we are not putting any great emphasis on a particular date. We're just saying you need to make some assumptions. You need to come up with these trade-offs. And one of the amazing things we found right at the start, and an economist called Paul Freitas highlighted this earlier, was that if you use the value of life built into what's called the quality adjusted life years that the National Institute of Clinical Excellence use, actually you might never have started this lockdown in the first place. So now I infer from that the value of a QALY is too low, that NICE are using, and that I am very much in favour of keeping this lockdown going to the point where we'll be able to release it in phased steps, but not have to have 2 goes at it, as it were, to repeat the lockdown again, because I think that's difficult for people behaviourally and difficult politically.
Now, deciding what goes into this well-be cost-benefit framework for determining policy decisions is obviously going to be crucial, but it's also likely to be contentious. Some people will no doubt argue that something they think is important has been left out, or that not enough weight has been placed on what they thought was important. Lord O'Donnell, isn't there a danger here that we become bogged down in these kinds of arguments and that we fail to see the wood for the trees?
That's absolutely right. So I mean, if we'd had more time, I would have loved to have done this in a much more probabilistic way with fan charts like the Bank of England use at the end. That would have been my ideal analysis. Basically, we are starting to realize there are 3 or 4 really, really important factors. One being what's surprise, surprise, what's going to happen to the economy? How quickly does it bounce back? We don't know that, but you can do sensitivity around it. Turns out it's really important. Secondly, what value do you put on a quality-adjusted, a well-being, quality-adjusted life year or a well-being year? That's really important. And the third thing is, what path does the virus have? Now, this is where it's more difficult. The epidemiologists will give you some views. As you modify lockdown in certain ways by easing up in certain areas, possibly tightening up in certain areas. You know, we talked about why are we letting people in all the time from overseas? So there are some things you can do, and all of those are important variables. We know that things like mental health, domestic violence, air quality, commuting, that there are a whole long list, but actually we can then identify what are the really important ones. And yes, there are lots of factors, but it's important to stress the big ones. And if you get them roughly right, you'll get roughly the right answer.
Professor Coyle, you've been looking at measuring well-being for years, and to come up with an indicator of when we need to end the lockdown we need it in the matter of days or weeks. Have we got enough time to come up with a reliable, accurate measure of well-being in that time?
One important thing to realise is that whatever decision gets taken, there's going to have been some kind of cost-benefit assessment. And there's a choice between either making that implicit or making it explicit, as Lord O'Donnell is suggesting. And I'm all in favour of having a much more explicit discussion about this. People talk about the economy, and I don't think that's actually very helpful here, because everybody thinks that's about money and banks. It's actually about people. It's about what incomes are they earning, what jobs do they have, how much are they worried about getting food on the table. And there's really a good body of evidence that the longer people face that kind of stress and uncertainty about incomes and paying the rent and paying for meals, the greater the adverse effects on their health. And so you start to have to do these long-term, short-term trade-offs. And I'm not really fussed about what unit you use to measure, whether it's well-bees, whether it's pounds, whether it's any other unit you care to think of. But they've all got to be put into some kind of common currency. And you've got to start thinking about the long term, the longer this lockdown goes on. But it's not going to be possible to navigate out of this in any sensible way.
Now, the best policy ideas will never come to see the light of day unless they have political backing. One place where a well-being approach does seem to have political backing is New Zealand, where last year the government unveiled its first well-being budget.
Our mental health and well-being is not what it should be. So our plan is through the well-being work that we're doing, a living standards framework, and our well-being budget, where if you're a minister, you want to spend money, you have to prove that you are going to improve intergenerational well-being.
Now, Diane Coyle, I want to ask you first of all, what do you think of the New Zealand approach? Have they blazed a trail which other governments should and could follow?
I think they probably have, and New Zealand has a history of innovating in policy in many ways. And what I like about it, it might differ in detail from the way I think about things, but what I like about it is that it draws attention to things that economists and politicians have not paid enough attention to in the past. And so one obvious example is the state of the natural environment. And we know that we have been using up natural resources to grow GDP and consumption now at the expense of incomes and consumption in future. So we ought to be tracking that. But we're also learning at the moment about how important it is for people to have access to the natural environment, and for their mental health and for their well-being, for their daily exercise. And it's actually been years since money got put into public parks in a serious way, in maintaining them, in having park keepers who look after them and monitor what's going on. So maybe this is an opportunity to rethink in that kind of well-being framework, something that has been ignored by politicians. It sounds kind of frivolous, doesn't it, caring about the parks at a time like this, but actually it does seem to have been profoundly important for people's well-being.
When you were Cabinet Secretary under David Cameron, that's when he asked the Office for National Statistics to start attempting to measure UK national well-being. Do you sense that the current government has an appetite and a willingness to follow that way of thinking?
I'd like to think so. And this particular episode, in a sense, forces them to, because all of these issues have come together. When your colleague was talking about these numbers don't change very much, well, actually, they do change radically when someone moves from being employed to being unemployed, when someone moves from being in good mental health to bad mental health. Those differences are quite dramatic. New Zealand's paved the way. You know, there are successful governments around the world, curiously enough, quite often led by women, who are making a real difference and thinking about the well-being aspects. Scotland, for example, Nicola Sturgeon's talked about this a lot. So I hope that we will get to a stage where these things start to mention. Diane mentioned green spaces. I mean, one of the great advantages of what David Cameron did is we can now tell you that actually, you know, having access to green spaces does make a big impact on your well-being, and hence one of the reasons why, if you're locking people down who live in you know, a tenement building, no garden, no access to get out, with children around them, we can see that their well-being will go down quite dramatically. So I think and hope that this government, you know, Matt Hancock's got an economics background, he knows about all of this stuff, and I think he's been quite sympathetic to the well-being approach. It's just, I'm hoping that this crisis, you know, we'll see lots of good things come out of it. Diane mentioned the things that have been neglected. If you look at this crisis and why we've had the lockdown straight away, it's because it's been visible and immediate consequences of a problem. And so we've changed behavior unbelievably radically in ways I never have believed. When you think about a climate change debate, we're asking people to change their behaviors. The problem there is it's for not such an obvious and immediate threat. And if we can get across to people that actually we really do need to change our behavior now for this future threat, that we might come out of this crisis in a better way. And I really hope we'll get the consequences, what I call social togetherness. You know, I'd really, rather than social distance, I would like the mantra to be physical distance and social togetherness. Physical distance being the WHO term. And social togetherness, because we should start helping our neighbours more, we should start caring for each other. And there's been dramatic examples of that around the whole country. People helping out their neighbours, looking after the more vulnerable groups. You know, that's an enormous benefit. And we know that people's well-being goes up considerably when they help other people.
This is why I'm so keen on having statistics to measure these quite fuzzy sounding ideas. Or to put better figures on the environmental damage that we're doing, or the benefits that the clean air and the green space bring to people. Because it's actually hard for politicians to act on things when they don't have any solid seeming data that they can rely on. So that's really important. But this point about social togetherness, I think, is really important. We've done a little bit of work looking at how that corresponds to the mutual aid groups that are now springing up. They are springing up around the country, but they're springing up much more in places that are already quite affluent, have quite high, what an academic would call social capital. And so my concern would be that what's happening now is actually exacerbating existing inequalities. So it's the people who live in flats with no green spaces, they don't have a very strong sense of community already. They're the people whose incomes are going to go down if unemployment goes up and stays up so high. I would be concerned about those kinds of social fractures and the inequality in well-being, as well as the obvious kinds of inequality.
Exactly. And if you think of what Boris Johnson's government came to have their key phrase, it was levelling up. I fear we risk actually doing the opposite because of the way the economic consequences of this. We know the IFS work, Institute of Fiscal Studies, has shown that it's low-income groups who are much more likely to be in a sector that's been laid off, 2.5 times more likely. It's having a gender bias effect on women. You know, there are all sorts of inequalities that are being amplified by this crisis.
A model is only as good as the data that we put into it, right? If the inputs aren't very good, the outputs won't be either. And Diane, I wanted to ask you, the lockdown's fundamentally changed our ability to do many things. Has it changed our ability to collect good data?
It's going to be hard to collect the standard official statistical data. You know, collecting prices from shops. The shops aren't open. The collectors can't go out. The Office for National Statistics here and other statistical agencies are doing a fantastic job looking at all kinds of other indicators to get an up-to-the-minute picture of how badly activity is being affected by the lockdown. So looking at things like freight and road traffic and so on. The big tech companies have started putting out some data on similar things. And a colleague of mine, Vasco Carvalho at Cambridge, has looked at some banking transactions data in Spain to track not only how much people are spending, how much that's down, but what it's on which parts of the country and so on. I think this highlights a longer term challenge really, that I would like to see much greater access to a lot of the data that private companies hold themselves to supplement the things that we always think about like GDP and inflation.
And Lord O'Donnell, in your paper, you illustrate how Wellbees could be used to argue that the lockdown should end in June. Given the uncertainty over the economic and epidemiological data and the uncertainty over forecasts, isn't it kind of unsuited to giving specific advice on precise and short-term policy watersheds?
The decision that COBRA, that Prime Minister will have to make when he goes in that COBRA, will be, so when, at what point are we going to start to ease this lockdown? What I think we're arguing is you need a proper cost-benefit analysis for that. Some of those factors will be very difficult to estimate precisely, but actually getting a rough estimate of the right kind of concept is really important, as opposed to having precise figures on things like deaths and cases, which are actually, direct deaths and cases, are actually only part of the story. So it's not going to get rid of the judgment, but it is going to give you a framework for talking about all of these things. And I think along the way, we're going to realize, as Diane has been writing for many years, that actually the idea that GDP gives you a measure of success of the economy or how well people are doing is wildly inaccurate. It's an activity measure. The government has deliberately reduced activity, reduced GDP. And you know, there are lots more factors influencing how people feel.
If I can come back to your question, Lizzy, it's not just the data in the models, it's the models themselves. Economists have taken a lot of stick about the inaccuracies of their models over the years, but that's true of any model, and that they're all going to tend to be wrong. So it's just as true of the epidemiological models. And I would like to be sure that the models that the epidemiologists are using, which like economist models differ among themselves and have different kinds of predictions, do take account of the way people's behaviour changes and the way that economic incentives change the parameters that go into the epidemiological models. So those things are not, exogenous in any way. They are socially determined themselves. And that's why it's really important to integrate these approaches and get the whole picture of what's going on.
And that's why, if I could just add one point, that's why we'd like to see around the table not just the epidemiologists, but the behavioural scientists and many more of the social scientists, because actually all of those things matter.
Before we go, I'd like to ask you a little bit about the post-corona world. First of all, Diane Coyle, the fact that so many governments have effectively suppressed GDP by enforcing these lockdowns, does that in itself perhaps suggest that GDP is already becoming less important to the way governments think about economic well-being?
The problem I have with GDP is that it's been the only thing that people look at. It's still an important indicator. You know, it's actually highly correlated with people's well-being, and that's because it measures to some extent what jobs do they have and how much income do they have to pay for essentials and for things that improve the quality of life. So it's not that it's unimportant. I think the mood about, that message had been sinking in anyway in policy circles, not just in the UK, but in lots of places. And nobody had been quite sure what to switch to. And one of the things that I think will emerge from this crisis is a better understanding that the one measure doesn't give you the whole story. And we need to start thinking about broader indicators of well-being. Prominent among those will be all the public health indicators, how public services are doing, but also I think a lot of people are now emphasising the environmental questions and all of the other things that go into this broad understanding of people's well-being. I think things will change after this crisis, building on a kind of trend that had started already, but this really cements it into place.
Lord O'Donnell, Moving beyond Corona slightly, do you feel that there's actually already a public appetite for politicians to put more emphasis on things like environmental sustainability? Are you effectively perhaps pushing at an open door with this approach that you're advocating?
Yes, I find this debate quite difficult because it seems to me completely unbelievably obvious that there are far more important things. You know, as Diane said, incomes certainly matter. Everything on well-being, particularly at low levels, these are hugely important. Having a job is hugely important. So why we kind of think about measures which were devised, even Simon Kuznets that devised GDP, you know, did not suggest this was a success measure. So it's an important measure. I don't want to get rid of it, but there are plenty of other things we need to put alongside it. Thanks to David Cameron, we have better data now. We've had that since 2011. There's a lot of analysis. There are global studies. You know, we need to do more. We don't know enough yet about the determinants of well-being. A lot of work going on. So nothing's going to be very precise, but let's at least have the debate about the right issues, about the things that really matter to people's lives.
And when we start thinking about this, I think it will take us into some directions people haven't really thought about. So the example we used earlier was people's access to green space in this time of lockdown. And if you think about that long term, that really speaks to urban design. We've got cities built around cars that don't have enough green spaces in them. Some of them are very grey centres. So they're noisy, they're hot, there's none of the cooling that you get from greenery in urban spaces. So we might ultimately be talking about a really big redesign of the kind of cities that we have. You know, including less density in lots of parts of the city than we've had in the past.
And just to add to that, we've suddenly had a natural experiment where people might have said, well, you know, what if there were no cars? You know, what if we had a car-free day or whatever? Well, actually, now we've had a period where our main cities, the level of car traffic, of all traffic, has gone down dramatically. And we're able to see, well, what's that done to air quality? What's that done to people's view about how they feel about returning to congested cities with cars with all the time? Should we be thinking about more radical ideas about, you know, Paris has car-free days. Why would we not think about, now that people have seen this and that's influenced their behavior and possibly the way they think, that maybe there's a chance to start thinking about some of these more radical behavior change ideas.
Well, thank you so much to our guests, Lord Gus O'Donnell and Diane Coyle, for talking to us on this programme.
We'll be talking to many more top thinkers in the weeks ahead to discuss how to weather the economic storm of COVID-19. So please do stay tuned and subscribe to our YouTube channel.
And remember, if you like what we're doing, please hit like, share and subscribe.
And if you'd like to talk to us, please just leave a comment below.
This has been CoronaNomics, brought to you by Econ Films.